in the heart of South Delhi. Hey, light clean.
Hello, I am Dr. Kapil Agrawal and I am working as a senior consultant, laparoscopic and robotic surgeon at Apollo Group of Hospitals, New Delhi. So today we are going to discuss about a very common medical condition, hernia. And in this section, we will try to know exactly what is hernia, what are the symptoms, what are the different types of hernia, and how to diagnose a hernia. Now, if we try to understand hernia in very simple terms, our body or the abdomen contains some very vital or important organs like liver, spleen, pancreas, and intestines. Now, these organs are protected by a strong layer of muscles, and this layer of muscles is known as abdominal wall. Now, whenever there is a tear or a gap in this layer of muscles, these vital organs, especially intestines and omentum, starts protruding out from this tear or gap. This protrusion appears to us as a bulge just below our skin, and this bulge is known as hernia. Now, initially, this bulge is reducible. It means that whenever we put strain on our abdominal muscles, like while coughing, standing, or while passing stools, this bulge will become more prominent, and when we relax our muscles or when we lie down, this bulge will disappear on its own, and this condition is known as reducible hernia. Now, if we don't get the treatment in time, the intestines or the omentum starts getting stuck up in this tear or gap, and it becomes a permanent bulge. It means that our intestines or the omentum are permanently stuck up. Now, coming on to the different types of hernia. Hernia can occur in different areas of our body, and the most common type of hernia is the groin hernia. Groin hernia usually occurs at the junction of our abdomen and thigh, and the groin hernia can be of two types. It can be inguinal hernia or it can be femoral hernia. Inguinal hernia is more common as compared to femoral hernia, but it is very difficult for a lay person to tell whether he is suffering from inguinal hernia or a femoral hernia. The next common hernia is the umbilical hernia or the belly button hernia. This hernia occurs just above the umbilicus or around the umbilicus. If the hernia occurs between the umbilicus and our sternum or the chest bone, it is known as epigastric hernia. Sometimes when a patient has already undergone a previous abdominal surgery, the underlying stitches tends to open and a bulge occurs just above the stitch line, and this type of hernia is known as incisional hernia. It means that the hernia is occurring over the previous scar mark, and it usually happens due to the opening of underlying muscles. Now, coming on to the diagnosis of hernia. Now, hernia is basically a clinical diagnosis, and your surgeon can 95% of the times tell you just by examining you that what type of hernia you are suffering from. However, if you are suffering from a very small hernia or you are only experiencing pain without any bulge, then we might take the help of ultrasound, CT scan or MRI to diagnose this type of occult hernia. So I hope I could make you understand exactly what is hernia, and if you think you are suffering from hernia or anyone you know is suffering from hernia, you can please contact us at Habilite Clinics and we shall be happy to assist you. So kindly share, like or subscribe, and please send us your comments exactly what you think about hernia.